Hello everyone. So today we're going to talk about food challenges. And so this is for people that are going to do a food challenge in hospital, or maybe they've asked you to do a food challenge at home and a lot of this would be relevant. But this is generally for people who are doing food challenges in hospital. So I've got some notes here with me, so I don't want to forget anything. So food challenges are still the gold standard in Australia and the UK and the US for knowing for definite whether someone actually has a food allergy or not. Alongside skin prick testing, they're the two main things that tell you exactly where you're at with your child's food allergy, because the immune system is completely changeable. It is its own separate beast and it will do whatever it wants to do. So the only way we sometimes know for definite if a child does still have a food allergy or does actually have a food allergy in the first place, after doing tests like skin prick testing and taking a full history, which is really, really important, then the last thing to do, sometimes if it's right for that child, is bring them into the hospital to have a food challenge in a safe environment. Sometimes the doctor might think that your child is so low risk that they might ask you to introduce the food at home. So on the day normally, and I'm going to speak from a general point of view from the hospital that I worked at for 10 years and the way that we did things, but just know that every hospital can be slightly different. So there might be nuances in what I'm saying and what the hospital that you go to. So generally, if the skin prick testing had been done 6 months prior, or within 6 months prior, then we wouldn't retest on the day. But if the skin prick test was older than 6 months, then generally on the day we would re-skin prick test to that, just to that food, not the whole panel. And quite often the food might have been, the result would be quite different, either vastly bigger, and then we would cancel the food challenge and we wouldn't do it, or sometimes really, really small. That just gives us more, reason to go ahead with the food challenge on the day. So unfortunately, wait lists in Australia are really high for food challenge, and sometimes a child can wait so long that their body has actually decided to become more sensitive to that food. So the skin prick test size is bigger, or they have actually grown out of it by the time they get there. So we would still go ahead with the food challenge that day if their result was showing much smaller, but it's just another good indication. Generally what we do is follow ASCIA action plans. There is, ASCIA is the Australian Society of Australian Society of Clinical Immunology and Allergy, and they have protocols for like nut challenges, baked egg, baked milk, and then like generic food, which you can work out how much protein you need to give the child. So for instance, green beans don't have much protein in them, so you need like a bucket of green beans, but obviously you wouldn't give that amount of green beans to a child, so you wouldn't give that amount of green beans to anyone. So what you then do is give just a normal portion if the portion is going to be too big. So generally what happens is that food will be given over round about 5 to 6 doses, and you start off very, very small, like 0.6 of a gram maybe, or some, very, very tiny amounts, and then they get slowly incremented up. So for instance, in a nut challenge, you end up giving like maybe a teaspoon, sometimes 2 teaspoons of the whole nut by the time you finish the 5 to 6 doses. They're incrementally placed so that there's a 20 to 30 minute window between each dose, just to check to see if any allergic reaction occurs. Yes, allergic reactions can occur in up to 2 hours later, but generally a lot of the time allergic reactions will happen within that first 20-30 minutes, even within the first 5 minutes. So with an egg challenge, by the time you've got to the last dose, your child has generally eaten a whole egg. And with baked milk or baked egg challenges, we start with a 16th of a muffin, then an eighth, then a quarter, and then a quarter, and then a quarter until the whole muffin has gone. So that's just generally how food challenges work. We like to have you there. We like to do observations before the food challenge starts so that we've got a good baseline for your child's blood pressure and heart rate and respiratory rate. We generally don't always check their temperature because it's kind of irrelevant for the kind of test we're doing. And bearing in mind your child is well when they come in, so we're not necessarily having to do a full panel of observations. We do try to do a blood pressure on all children, but obviously sometimes with the younger children, when they're squirming around, it can be really hard to get. So generally we just check that they are well that day. There's no viruses lingering. They're not coughing and sneezing all over the place, because obviously that's going to interfere with any potential symptoms from an allergic reaction. And that just generally they're not on antibiotics. Their immune system isn't heightened for any other reason. They're not sick. Maybe they haven't had gastro or anything like that. We just want them to be generally well coming into a food challenge. So usually we only let one parent come on the day, but that's kind of really like a hangover from COVID. So generally we only let one parent come during the day with the child, but really that is kind of a hangover from COVID. So sometimes we'll let both parents come. Sometimes the parent needs moral support, so depending on the family. You might also already be in a room with lots of other children having food challenges as well. It can feel quite overwhelming and a bit daunting that, oh my goodness, there's other children here eating food that my child is highly allergic to. But we are very careful, and with you're in good company in a room full of other allergy parents that are very aware of that. And they're very aware that they don't want food being spread all over the place. We do ask all children to sit down in their chair or in their parents' lap when they're eating the actual dose. And once they're finished and their face is wiped and their hands are clean, then they can go off and play again. So we do have quite a controlled environment. Once all the food has been given, we then like to keep the child for 2 hours. So that just gives us a good idea of, we have seen many children react at 1 hour and 45 minutes. It's not that unusual. But generally, once you get to the 2 hours, the food has been quite well digested. If not all, most of it has been digested. We haven't let the doses be any more than 20 to 30 minutes apart, because this is the thing. If it takes all day to get those 6 doses in, it's not really accurate, because the first tiny little bit is not, it's digested and gone by the time they've had that last dose. And what we want is for that whole amount of food, all those doses, to kind of be in the stomach at the same time, so that we know that the body can tolerate that amount of that specific food. So we keep you for 2 hours after, and then once you get to the 2 hours, we'll discharge you. So if, say, your child reacts to the first dose or the second dose, and then we decide to stop, because sometimes food challenge is very, it can be subjective and objective. So objective in the way that you can see symptoms sometimes. You can actually visualize them. You can see swelling. You can see the redness and the hives. Sometimes it's subjective, where it's the child saying, this is happening, that's happening, I feel funny, I feel dizzy, so there's a lot of moving parts in a food challenge and in an allergic reaction. And sometimes if we do actually have to stop a challenge, we will then say, we'll keep you for 2 hours from that last dose. If the child is saying that there's a symptom, what we tend to do is, but maybe we're thinking, we're not sure if that symptom's really there. We think that they might just be really scared, which is absolutely a common thing, because these children have had horrible reactions to this food, or these foods have made them feel very, very ill. And so no wonder they're very resistant to wanting to eat them sometimes. And also the hospital environment can be, very clinical, and it can feel like, quite daunting for the child and the parent. So sometimes we speak to the parent and say, what do you think is happening here? Do you think maybe we're just quite frightened and they don't want to eat it? And sometimes that can cause quite a delay. Sometimes they just don't like the taste of the food. So we have mixed all sorts of things with all sorts of things. You wouldn't believe the kind of recipes and potions we've dreamed up in Food Challenge. We use lots of chocolate and strawberry sauce and sprinkles. We use lots of ice cream with egg. We've tried all sorts of different things, but at the end of the day, if there's too much of a big gap between giving the food, then we have to kind of call it a day and say, look, we have to revisit this maybe in 6 to 12 months' time when the child's a bit older, willing to participate in it, and they maybe don't feel so. Generally, before the food challenge, we say that we don't want them to have an antihistamine for 3 days before. If you have given an antihistamine 3 days before, don't just cancel. Talk to your food challenge department or talk to your doctor and find out whether it's still okay to come, because sometimes there is a little bit of leeway if it's been 24 hours or so. If your child is on oral steroids for asthma, then we do need to know about that, because we definitely don't want you stopping medicines like that if your child is needing them for an asthma attack or something similar. So please let us know. The chances are we won't go ahead with the food challenge if your child is still needing steroids, but we definitely don't want you to stop the inhaled steroids. We don't want you to stop your child's maintenance inhaler. If they are needing lots of the blue inhaler, then we need to know that too, but please speak to your department first. And it's probably on your paperwork anyway, but we definitely don't want you stopping any inhaled steroids. Oral steroids in the way of syrup or tablets, that's different, because they're normally given because of an acute illness, but the oral inhaled steroids are normally something that a child has long term, so we definitely don't want you stopping that. It's really good to bring along your own snacks as well. Sometimes you won't actually be able to get away. And there's obviously should be lots of drinks available, and there's often some food in a hospital kitchen. But my advice is, because you're going to be there for about 5 to 6 hours, if not longer, is to take your own food in a lunchbox. There will be fridges normally for you to keep your food in if you want to at the food challenge department. But definitely take lots of snacks, because you also might need to mix that food that your child's going in for with some very familiar foods for them from home too, like familiar crackers or things like that. The other thing is that, yes, there probably will be a TV in the food challenge room, but you might want your own entertainment. So laptops, there's usually Wi-Fi laptops, tablets, phones, things like that. I would recommend taking them if your child uses those devices. If not, you can absolutely take your own toys, your colouring books, things like that, because it can be quite a boring day. And I hope for you that it is a boring day, because we don't want too much excitement out of food challenge. But yeah, just take things for your child to keep them occupied. Definitely read the paperwork from wherever you're going for your food challenge, because they might need you to bring some of your own food. So things like seafood, crab, fish, prawns, things like that. We often ask people to bring 2 raw eggs. We'll cook the egg there. Obviously, not the muffins. The baked muffins, we ask parents to cook as well. Again, check with your hospital, because they may provide those kind of things. The only thing that the hospital provides where I worked is the nuts and the milk. And often the wheat. But again, if it's a wheat challenge, you might need to ask if you want to bring specific pasta or bread or things like that. You might want to bring specific soy milk or almond milk, or things like that. I mean, almond milk probably not. There's not very much protein in that, but yeah, especially soy milk, things like that. If you are going to take your own pasta, yes, you can cook it ahead of time, but don't add anything with it. Maybe a little bit of seasoning, but don't add lots of other food with it, because we need to measure out the pasta specifically to know how much protein's in it. So I hope that's helpful today. If you have any questions, as ever, you can pop them below. If you're listening on our podcast, please subscribe, because it helps other people like you find us. And if you're listening or watching this on YouTube, then please subscribe, because again, it helps push us out to other parents that have similar likes and similar needs, just like you. So I hope this has been helpful for you. Please let us know what you think of this podcast, and follow us over on Instagram at the Nest CPR, and we'll see you soon.